Hello, our dear viewers. Welcome to another episode of Afya Health and Lifestyle Interview Series. Just like every other day, we are here to educate and inform you about common health conditions, how to prevent and how to treat them, and also to counter the misinformation and myths that are out there. My name is Foli Oluwaremilekun, your host, and with me today to talk about amenorrhea is Dr. Ronke Awe. Before I bring her up to discuss extensively, I'd like us to get to know her better.
Dr. Awe completed her basic MBBS training at College of Medicine, University of Lagos, Nigeria in 2000 and moved to England in 2006 for postgraduate training in obstetrics and gynecology at Southwest Peninsula Deanery. Dr. Awe is experienced in single and multi-site service delivery through tertiary and district hospitals. Dr. Awe has always been passionate about fertility management and reproductive medicine since her undergraduate days. It therefore wasn't surprising that rather than seek a consultant appointment after completing her core obstetrics and gynecology training in 2016, she proceeded to a fellowship in fertility at Salisbury Fertility Center. She then worked for another year as a post-CCT specialty doctor in obstetrics and gynecology and reproductive medicine at Derriford Hospital, Plymouth, where she was the fertility preservation lead and recurrent miscarriage at Southwest Center for Reproductive Medicine. Dr. Awe was also a visiting lecturer for biomedical sciences at Plymouth University, and she is passionate about training. Currently, she is a consultant in obstetrics and gynecology with special interest in reproductive medicine at Shrewsbury and Telford NHS Trust. Dr. Awe co-authored a chapter on cesarean delivery and peripartum hysterectomy in the second edition of Contemporary Obstetrics and Gynecology for Developing Countries in 2020. And her paper, The Review of Results of Fetal Fibronectin at the Royal Cornwall Hospital, Treliske, was published in Journal of Obstetrics and Gynecology in 2020. Dr. Awe completed her basic MBBS training at College of Medicine, University.
Welcome, Dr. Ronke Awe. We are really excited to have you on our show today, and I'm pretty sure our viewers are looking forward to learning one or two from you today. Would you like to say hi to our viewers, ma'am?
Hello, viewers. Thank you for having me on this platform. I'm excited as well, and hopefully be able to learn more than one or two things, I hope.
All right. Thank you very much for joining us, Dr. Ronke Awe. So, going straight into the topic, when we say amenorrhea, what exactly are we talking about? What does it mean? What are the implications on a woman who has such?
Right. So, amenorrhea means the absence of menstruation. It means menorrhea, no periods, no menstruation. It can be either primary or secondary. We say it's primary if a woman has never had a period and she's 15 years old. You begin to worry, especially if she doesn't have any other sexual reproductive development, like developing a breast, having pubic hair, armpit hair. You begin to worry and then send her to see the gynecologist. Or we have what we call secondary amenorrhea, and this refers to when a woman who's always had a period then does not have a period for more than 3 months.
Okay.
Then it becomes something she needs to investigate. And there are lots of causes of amenorrhea. Also, when the patient comes to see you, there are lots of questions you need to ask the patient about other symptoms that will tell you or help you to know exactly what is causing her not to have a period.
All right. Thank you very much. Primary, secondary, depending on whether the person has had periods before. All right. So, in the case of primary amenorrhea, what are the things that can cause primary amenorrhea? And when somebody has primary amenorrhea, what does it mean? What will happen? Like, what are we expected to see?
Right. So if you go to primary amenorrhea, there are things you look out for. You look out to see if a woman has got other secondary developmental features, like is a woman developing a breast? Has she got hair in the armpit and the pubic hair? Primary amenorrhea can be caused by a lot of things. So, for example, it could be hormonal. It could also be structural. So, for example, there are women who are born without a womb. So, if that is the case, for example, when you examine the woman, you may not find much in your physical examination, but then you may have to do other things like doing a scan, ultrasound scan, and the ultrasound scan will show us that she doesn't have a womb. Then we do genetic testing to look for genetic causes of her not, what's wrong with her and things that could be done. When it comes to secondary amenorrhea, there are different causes of that. In fact, before I go to secondary amenorrhea, for another structural cause of amenorrhea could be a woman who is developing properly. She's got breasts and she's got pubic hair. She's changing her figure like you would expect to see in puberty. But when you then question her a bit more, she tells you she gets this tummy ache every month, which people that have periods get. And it's not, she's not having a period. And for example, when you examine that woman, you may feel a mass in her tummy. So for such a woman, you would go do more imaging, like an ultrasound scan. And the ultrasound scan will show you that, yes, she has a uterus, but she's not got a big uterus that is full of blood or full of blood clots. What's the reason? It's because she has structural problems in the vagina. So her vagina did not open up properly when she was in her mother's womb. And she didn't, nobody really knew that. So that one is easy. You just take her to theater and you open up the hymen or open up the vagina if it's just in the vagina. And that way, the woman can then start having regular periods.
All right. Thank you very much, ma. We can now go ahead to the secondary causes of amenorrhea. What are the secondary causes for the secondary amenorrhea? What are the causes for the secondary amenorrhea?
So the most common things are the natural amenorrhea. And the first thing we have to think about is pregnancy. So if anybody comes to me and say, oh, I've not had a period, the first thing you do, give her a pot, go and give me some urine sample, you dip it, and you say, well, that's why you're not having the period, is because you're pregnant.
Yeah.
Also, women that are breastfeeding, at times when they are breastfeeding, that's why some people use it as a natural form of contraception. But it's not for everybody, because for some people, even when they are breastfeeding, they are still releasing eggs and they are still having periods. So, but for breastfeeding, it could shut down the cycle in the brain that leads to ovulation. And if that's the case, a woman may not have a period. And for some people, once they are doing exclusive breastfeeding, no period at all, and usually they are good. Is a good form of contraception for those women. But I will always advise to use contraception, except you're ready to have another baby soon. Another natural cause would be menopause. People go through menopause. So the average age for menopause, it's about, for a Caucasian, it's about 51. For Africans, from the studies, because I don't work in Nigeria any longer, but from the studies and I've read, it could be about 53 or even up to 55 for some African women. But unfortunately, some people actually have what we call premature ovarian failure or insufficiency, as some people like to call it now, because we don't want to use the word failure as it denotes that they have failed. Or some other people call it early menopause. And that is when you stop having your period before you are 40. So that is another cause of
Amenorrhea.
amenorrhea. Other causes could be medication. There are some drugs that people take that can affect their periods. For example, contraception. Some people, when they are on the contraception, do not have any period at all, especially with the mini pill at times. Some people do back-to-back periods. They don't have any period. Some people use the Mirena oil and they just become amenorrheic. Not for everybody, it's about 3 in 10 women will become amenorrheic using the marina coil.
Okay.
Other drugs like cancer chemotherapy that affects the ovary, and the ovary at times does not go through the normal cycle that it has. Some drugs that are used for psychosis, antidepressants, some blood pressure drugs. So it's always nice to do a detailed drug history and to see if the drug the patient is using is causing the amenorrhea, which is not having a period. Another good cause that we don't think about is lifestyle factors. Some people want to
Okay.
be skinny because that's what it's in vogue now. You want to be size like we say it in Nigeria, in Yoruba, I should say, not Nigeria. So when you have an excessive low body weight, or when you have lost a lot of weight suddenly, it might affect you having a period. If you lose more
Okay.
than 10% of a norm of if you're under 10% of a normal body weight, you might actually become amenorrheic. Some people have eating disorders like anorexia, like bulimia, and that causes them to have amenorrhea as well. Finally, the young girls that are athletics or that do excessive sports, very rigorous exercise, also have could also become amenorrheic. I always say that women, we are full of hormones. So during stress period, I remember when we were in medical school, I had a colleague that during the exam period, she never gets a period because she's so stressed. So the stress also has an impact in having a period, not having a period. When it comes to structural reasons for not having a period is at times when a woman has had instrumentation or an operation to our uterus. Our uterus is our womb. When she's had operation like a D&C, not just for not termination, or it's just for other things. Maybe she's having heavy bleeding and they did a D&C, or she had a miscarriage and they did the evacuation of the retained products in a uterus, or even she's had whatever it is that she's had, the resection of a polyp. If it's been too hard, she might develop scar tissues, adhesions in the
Issues.
womb. That's called Asherman's cyst, and that can affect a woman from having a period. So yeah, I think that's it's a good summary of causes of um,
All right.
amenorrhea.
Thank you very much, my Dr. Ronke Awe. That was very, very extensive and broad. One thing we can take away from that is there are various and numerous causes for
Absolutely,
amenorrhea, and of
absolutely.
course, none of them is spiritual, like a lot of people think. And I think it is important that we are able to put that myth down and end it, so that people would know that sometimes these things are natural, have causes, and they
Absolutely.
can be treated. So, thinking about treatment, I would like you to point out the common causes from all of the causes you mentioned, the common ones, and how they can be treated.
I think one thing that before going to the treatment, I'm going to talk about another common cause I haven't spoken about actually. That's the hormonal one. So there are times that people have hormonal problems, like when they have like hormonal imbalance, or they have things like polycystic ovarian syndrome. That's something else, but that one usually causes what we call oligomenorrhea as opposed to amenorrhea, which means like 2 or 3 cycles in a year as opposed to no periods at all.
None at
The
all.
other hormonal one we need to think about is the thyroid. So if the thyroid is too active, that is overactive, or underactive, it could affect our periods as well. If a woman has a tumor in a pituitary gland, which is one of the um, structures that we have in our brain. So if a woman had a tumor, that could also affect the ability to have a period. So that's just to round up on the courses. So moving to your next question, which is about treatments, and now in that one I will talk about investigations as well, so that we can wrap it up to have a complete management. So let's start with pregnancy, for example. If she's pregnant, she's pregnant. we wish her the best of luck in her pregnancy. If she's got a structural problem, for example, we correct it as much as
Yes.
possible. So for those that have no uterus, the good thing is now we've had lots of pregnancies with uterine implantation. Is I don't think it's in Nigeria yet. It's not even that active in the UK, but I know that in Europe, in Sweden,
Okay.
there's been lots of people who have successfully had uterine implantation or transplantation, should I say, and have had successful pregnancies. And for some people, not even just one, they've had more than one pregnancy. So I think that is
Yes.
hope for those that have been born without a uterus. For those
Uterus.
that have structural problems with their vagina, for example, those ones will need to have operation to open up that the so if this is the vagina and it's blocked, that's the easy one. You just cut open the blockage. For some people, they have no vagina, and a new vagina can be refashioned to help them to have the period and save their uterus. For those with thyroid problem, whether you give them the medication that will reduce their thyroid stimulating hormone level or that would increase it depending on what their problem is, whether high or low. Um,
No.
those who've had premature ovarian insufficiency, early menopause, we need to do some genetic tests to look out for things that affect or that causes early menopause. We look for some things like Turner syndrome to make sure that they don't have Turner syndrome. We look for Fragile X to make sure they don't have any of those things. So it's genetic investigations, and then a lot of counseling
Okay.
and support, because especially in Africa where we come from, and not just Africa, a lot of women have that ambition to want to be a mom sometime in the future. So being told that you've
Yes,
gone
ma'am.
through the change, you've gone through menopause at 25, it's not funny. So it gives a lot of support for their mental health. So people that have had
Health.
Asherman syndrome, maybe they've had scarring, they have what we call an hysteroscopy, which is putting a camera through a telescope really through the vagina to the neck of the womb to look at the inside of the womb, the cavity of the womb, and then cutting the adhesions, the scar tissue. Once we've done that and we are happy, we have to do it carefully that we don't make a hole in the womb. We then put a coil inside to prevent it from gluing up again. So that's for structural problem. For those who are
Okay.
under stress, we try and ask them to either change jobs or try and remove the things that is causing them stress, or go
Yes.
for counseling to help reduce the stress. Those that are
Stress.
having eating disorder, they need help from their mental health team. Get the mental health team involved to help them hopefully go through that and gain weight. I must say, in my practice, I tell more people to lose weight to help them get pregnant or to help them, attain better success for their procedure than I do tell people to increase weight. So when I have to tell a woman your BMI is only 16, I need it to be at least 19, and then hopefully that would restart your starting an engine, and you can start having a period again. I think those are the main things. If you are using medication that is affecting you, you stop the medication as well.
Operation.
Yeah.
All right. Thank you very much, ma. Our dear viewers, do not forget to subscribe to our pages across board, from Instagram to Twitter to YouTube. To subscribe, Agbari Multimedia. Thank you, Dr. Ronke Awe. At least we know now that there are solutions to virtually all the causes of amenorrhea. What we just have to do is figure out what exactly is the cause and let the
Absolutely.
proper professional take care of the problems, and then it all goes away. For the ones that like you've pointed out, some causes are pretty much natural, while some are basically caused by oneself, like medications and all that. So I think when we want to talk about the prevention of this, all we'll just be talking about is avoiding things that can cause amenorrhea. And what are example of such things we should avoid?
I would say the number one that comes to me is excessive exercise. Those are the simple ones. People that do too much training. Some people, if their lifestyle, if their work, maybe their athletics, and they have to practice and practice and practice to be able to go to the Olympics or to be able to go to a particular race that they are working for. People that do ballet as well, we tell them not to practice too much, and tell them, we need to let them know as well, because the truth is that if you're not ovulating, you're not having that. Ovulating means releasing eggs. If you're not releasing eggs, you're not releasing estrogen, which is a hormone that we need. And estrogen is important because estrogen can, if you don't have enough estrogen, it can affect things, like your cardiovascular, your heart. It can have problems with your heart later in life. It can also cause something called osteoporosis. That means that you can easily have fractures as you get older. So it's important that if a woman is not having a period, at least she gets something to give her the estrogen which she needs. So, for example, a woman who have got to become premenopausal, we give them HRT, that's hormone replacement therapy that has estrogen in it. Or for some of them, because they are young, they don't want their friends to wonder why they're having HRT. We give them the combined pill so that they can have pill. If a woman is on the pill and her period has not, and she wants to have a period back, she stops the pill. So these are little things like that. If you're on any antipsychotic, you stop taking your antipsychotics that could cause you to be not having a period. So these are basically what we do, especially because of the long-term complications that we
Sure.
could have.
All right. Thank you very much, ma. Looking at that, it is quite evident that every woman at one point in time will pass through this phase, especially towards the menopause stage. So, do
Yes.
you think there is enough awareness? Because out there are different myths concerning amenorrhea, and um,
Mm.
a lot of women are being shamed and all of that because of lack of awareness and information. So, do you think there's enough awareness, and how do you think we can do better?
I think that we don't have enough awareness as with all other medical cases. And you'd be surprised that it's not just in Nigeria, because I have women come to my clinic here in England who are in their 40s and are trying to get pregnant, and I tell them that their ovarian reserve is low, and they begin to cry and say, "Oh, nobody told me." And so you think that we are in England, where you can get any information you want, at the tap of a click of a board, or even to call or see your GP, and they don't have that much, they don't have that,
Information.
enough information. So how much more in Nigeria, especially in the villages or local area, there will be lots of myths, I'm sure. So I think what you guys are doing now is fantastic. So hopefully people would be able to um tune in and watch. I know that this is called good viewership. So hopefully the people that have listened today will tell somebody else and tell somebody else, and that way we're going to spread it. And we have fantastic gynecologists in Nigeria. I started my training in Nigeria in Louth before I relocated to the UK. We know we have fantastic gynecologists in Nigeria as well. So my key point is, if you're having any worries, don't go to any streets, anybody who is not a quote and unquote a quack doctor. So if you have any problems, don't go to any quack doctors, because you want to be treated on time. You don't want things to be complicated to a point where you can't be helped any further. So if you have any issues, go to a hospital, a private hospital that has a named gynecologist, or go to any of the teaching hospitals. I trained in Louth, started my training in Louth before relocating to the UK. And I know that last suit also, turns out lots of lovely gynecologists. So if you have any issues like this, please don't go to quacks, go to either um, um, just go to a teaching hospital where you will be given the best treatment that you need.
All right. Thank you very much, ma. Please, if you have any, our dear viewers, if you have any question or comment, go ahead and drop it in the comment section, and our guest would attend to them when she gets them. So feel free to ask any question of your choice. Ma, rounding up now, um, what advice do you have? I know you've said, oh, we should visit teaching hospitals and all of that, but looking at Nigeria's uniqueness in the sense that most of these health services that we get here are paid directly out of pocket. And a lot of people are even afraid of, oh, this teaching hospital are too congested before they would answer, before they would attend to us, and all of those things. So what advice would you give, knowing fully well that you trained in Nigeria also? So using that experience and that knowledge, what advice would you give to average Nigerian woman?
I think the most important thing is that every Nigerian woman, rich or poor, should be self aware. You know your body and know when things are not working the way they should work. Um, so this is not just for amenorrhea, this is for everything, every part of any kind of infection or disease or circumstances. Everybody, man or woman actually, should know their body. And when things do not appear to be going on correctly, seek medical help ASAP. If you can, start with the your doctor who is, your what we would call a GP, general practitioner here, or a doctor that you know is a doctor, because we also know that in Nigeria, sadly, not all roadside hospitals have doctors. Some of them are not trained doctors, qualified doctors. So make sure you go to a hospital that you know has a doctor. And also, if you're not getting the answer you want, you always have a right to a second opinion. Go to for another opinion. And it's a shame that there is no help for those that are helpless, those that do not have money. Because I'm sure somebody listening to me say, yeah, right, you can say that. But there are some people that cannot even afford to eat. So I don't know what the Lagos state government is doing or any of the other states are doing, but there should be a pot or a trust somewhere where people who have genuine medical needs can actually approach. And I hope if that is not in place, hopefully soon it will be in place where people can actually go ahead and say, I need to have this medication, I need to have this surgery, or I need to have a checkup, but I don't have access, and they should be supported. So that's the future. Hopefully, in the not near in the near future, we will have something like that in place to help our fellow Nigerians.
Thank you very much for joining us. This has been very, very enlightening. I am very sure our dear viewers have learned quite a lot. They are now informed, they know, and of course, we can keep passing the knowledge onto the next person and the next person till we get the kind of good health and right information that we seek. Thank you very much for giving us your time and knowledge.
You're
All right.
welcome.
To all our viewers, we say thank you for joining us once again this week. Till we'll come again next week. I remain your host, Foli Oluwaremilekun.